You did all of your research picking the best doctor. You put your deposit down and scheduled your surgery, and you're so excited. But what's next? Hi you guys, I'm Nikita. I'm the owner of Recovery Spa, where we do all things recovery, and I'm here to get you ready for your surgery. So without further ado, let's just jump right in. Diving right into number one, we want you to book wherever you plan on staying. Now this is for everyone who's going to be traveling, or heck, even if you're not traveling, I want you to think about where you're going to be staying. If you are traveling to another city or state, make sure you start looking into hotels and Airbnbs ahead of time. Make sure the environment is somewhere that's going to be safe and clean, minimal stairs and things for you to have to climb up and down. You want that environment to be a clean and peaceful place for you to stay, especially your first 24 to 48 hours of recovery. Now, for those of you who are going to be recovering at home, lucky you, make sure that your environment at home is going to be prepared as well. Some of my clients who live locally here in Austin may choose not to recover at their own homes, and the reason being is they have too many stairs in their home. Maybe their kitchen is on an opposite floor as their main living, or there's just too many inconveniences and safety issues. One of my clients chose not to recover at home because she had 3 small children under the age of 4, and she knew that being around her kids, they would want to run and jump on her after having her breast augmentation, and she was like, that's a heck no for me. So she chose to recover somewhere else. These are all things for you to start thinking about in advance. We're jumping straight into number 2, has a lot to do with the previous point, and that is preparing your environment. Now, whether you're going to be staying in a hotel, an Airbnb, or in your own home, you need to make sure that your environment is going to be conducive to your recovery. If you are having a mommy makeover, you may want to rent a recliner to rest in for the couple of days. Look into things that are going to make your recovery restful and convenient. You may not want to have other people sleeping in the bed with you, like your kids or your spouse. You want to make sure that if your bed is a little bit higher, that you have a step stool to get into the bed. All the little things. Walk through your home and your environment and make a list of the things that you are going to need to set yourself up for success. And make sure that you start doing this as early as possible so that you're not waiting to the last minute, and you have all the things that you need to recover. Number 3, book your massages in advance. I cannot express enough how stressful it is to, at the last minute, be calling everyone in town to find someone to do your lymphatic massages. And I guarantee you, if you're waiting to the last minute, you're probably not going to have access to the best lymphatic massage technician in your area. So make sure that you are booking in advance. Once again, if you're traveling to another city or state for your surgery, you want to make sure that you have lymphatic massages scheduled there as well as back home. And the main reason you want to have them scheduled in advance is that you know that that person's going to be available. You know if that person is able to travel to you, or if you will have to travel to them, so that you can arrange a ride to there, because you're not going to be able to drive, as well as any additional cost. Now, planning for budgeting is so important, and we have a separate video for that. But planning and budgeting ahead is really going to help you. A lot of people don't think about budgeting, and they wait to the last minute to book, and then they're like, oh crap, I don't have enough money budgeted for all of my massages. And that is a huge no-go, especially your first 10 massages. Those are so imperative for your recovery. So make sure you book before, way far in advance before your surgery, where you are as well as back home. The next thing to prepare for is going to be your diet. Now, your diet before and after surgery are both super important. Prior to surgery, you want to start thinking about starting to eat healthier. Whether you have weight that you need to lose, or not, you still want to start to eat healthier foods that are going to help you in your recovery. Changing your mindset about your foods and your activity prior to having your surgery is going to set you up for success. And after your surgery, you want to make sure that you have easy, convenient meals. You are going to be absolutely exhausted after your surgery. It's going to take everything in you just to get up and do the day-to-day basics, especially the first 24 to 48 hours after your surgery. So think ahead of simple, easy meals and snacks that you will have access to, so that you don't have to stress about what you're going to eat next. The last thing you want to do after surgery is to skip meals because you're not physically able to get up and get access to food. Eating is so imperative to your recovery. So make sure you plan your meals ahead, even if you have to use like a meal service of some sort where they're preparing your meals and they're just tucked away in the fridge. Or if you're doing your own meal prep prior to surgery and you're tucking your meals away. However you get it done, make sure that you're eating good, healthy meal choices. Planning what to eat after surgery can be a little confusing and maybe even overwhelming, but we've got you covered here at Recovery Spa. Our ebook covers the top 5 tips for post-operative eating, meal samples, protein shake recipes, local healthy eating options if you're recovering here in Austin, Texas, a meal planner, as well as grocery shopping planner. Check out the link below to purchase yours today. Our next tip for getting ready for surgery is to exercise. Now, I know this can sound counterintuitive for some people. You're like, no, the surgeon can just suck all the fat out, right? But the more that you are physically prepared for your surgery, the faster and healthier your recovery is going to be. So what do I mean by that? We talked previously in another video about visceral fat and how to get rid of visceral fat, because sometimes visceral fat can be stuck and stubborn fat that's under the muscle where your surgeon cannot reach it. Having an excess amount of visceral fat can change your results and not allow you to have the most snatch results that you want. On top of that, you want to have the best cardiovascular health possible for your recovery, because as you recover, your cardiovascular health is going to help with your circulation, and your circulation is going to help with your healing. So staying active all the way up to your surgery date is going to be a healthy option for you to create healthier habits that are going to be in place, as well as keeping your body tip-top shape. Lastly, if you create a routine prior to your surgery, it's going to make it so much easier for you to roll back into that routine after having your surgery, and your downtime is not going to be as difficult on your body. Next tip for preparing for surgery is to stay on top of your supplements. Now, every surgeon is going to have their own specific list of what supplements that they suggest for you. If you are interested in finding out the supplements that are most important, check out our video on supplements and the top ones that are important for surgery. Now, staying on top of your supplements is so important because these supplements are going to ensure that your body is prepared for surgery. Surgery can be very stressful on your body. You're going to lose a lot of blood, and your body is literally going to be stressed to the max. By giving your body the right vitamins and nutrients that it needs, it's going to help your body to literally repair itself. And this is so imperative. So make sure that you have a list of what's important for you to take prior to your surgery and how soon you should start taking those, as well as which vitamins and nutrients you should continue to take after surgery. The primary ones are the ones that are going to help to improve your hemoglobin levels, because you will be having a lot of blood loss during and after your surgery. Now, another cool way for you to stay on top of your vitamins and nutrients is IV vitamin therapy. If you have a surgery recovery nurse, this is something that most of them offer. Here at Recovery Spa, we have a surgery recovery drip that includes vitamins like vitamin C, as well as folate, that are great to help you to increase your hemoglobin levels, but also help with the repair of your skin and tissue, which is very important after having such a big surgery. Some other things that we're able to include inside of this drip are Zofran, which is going to help with nausea that's sometimes associated with post-op. conditions, as well as Toradol that's going to help with pain management. If you're interested in learning more about the post-op drip, click the link below for more info. Next is that dreaded to-do list that you receive from your surgeon's office. Now, there's a lot of things you have to do to get medically cleared and be prepared for surgery, and it can seem like a very daunting task. My biggest suggestion for all surgery clients is to get it done and get it done as soon as possible. Do not wait till the last minute on anything. If you require a physical examination, an EKG, or any of your labs, your best bet is to knock them out as soon as possible to get them done and get yourself approved and ready for surgery. There can be times where your labs are off. There may be something that needs to be increased, like maybe your hemoglobin level needs to be increased. If you wait to the last minute, you're not allowing yourself the time to make those corrections and possibly be able to redo your labs to get in the door in time for surgery. There are so many people that wait to the last minute, find out that they have a lab that needs to be corrected or some issue that needs to be corrected, and they have to be rescheduled for their surgery because of it. So don't be that person. Make sure you get everything done as soon as you possibly can. Our next tip in preparing for your surgery is to create a list and start packing early. Now, lists are so imperative, you guys, because there's so much you're going to need to prepare for your surgery. And if you're traveling out of town to another city or another state, oh my gosh, it's going to be an extra level of stress. So making sure that you start with a list is going to help to keep you on track of what you already purchased and what you're still waiting for, especially if you're waiting on some things to come in the mail. Create a list early on and make sure that you keep it close to your suitcase or maybe even close to your nightstand, somewhere where it's easy to find, and check everything off, not just as you receive it, but as you put it inside of your suitcase. Make sure you double check your list before you travel to make sure that you have everything packed. My next tip is to prepare for your travel home. Now, whether you're traveling multiple states or just down the street, your travel home is going to be, well, a little bit rough. So you have to think about what mode of transportation you're going to be traveling by, whether it's train or plane or even in just the backseat of your friend's car. And make sure that you have all the necessary things to make sure that you're going to be comfortable during that travel. Now, long road trips even can be uncomfortable after the first 30 to 40 minutes after having surgery. So start to consider things like backseat air mattresses, additional pillows, and things like that that can add extra cushion under you, as well as neck pillows that can be used to adjust in different ways. If you're traveling by plane, consider being the last person to get on the plane so that you have time to get up, move around, and walk into the very last minute when you have to get on the plane. Think about how you are going to move, sit, and lay, and make sure that you have on comfortable clothes as well as having extra pillows and cushions. Lastly, traveling is going to be uncomfortable. Make sure that you have your pain medication and make sure that you stay hydrated and get up and move and take breaks as often as possible. Now, my next tip is a little bit of a doozy for some, and it can be very tough for you to stop doing this, but it is to stop smoking. Now, every surgeon has their different requirements about how far in advance they want you to stop smoking before surgery, but my suggestion to my clients is to stop as soon as possible. If you already know that you plan on having surgery 6 months from now, the sooner you stop smoking, the better off your results are going to be, and it's going to decrease your risk of all of those crazy things that can happen if you continue to smoke. So let's go over some of the complications that can be caused by smoking before and after your surgery. The first complication is delayed wound healing. Smoking causes vasoconstriction, which just is a fancy word of saying you're not going to get the same amount of blood flow to that area. And as you've heard me stress in so many videos, blood flow equates to healing because your blood is bringing all the nutrients that you need to your wounds to heal, and that includes oxygen as well. Next, smoking can increase your risk of infection. Smoking weakens your immune system, making your body less effective at fighting infection. Now, after surgery, there's two big things that you are at increased risk of if you continue to smoke. And the first one is delayed wound healing, like we spoke about earlier, due to the vasoconstriction of the area. But next is also respiratory complications. We spoke in a previous video about how it's already hard to make sure that you are opening up your lungs and using all the parts of your lungs, and why it's important for you to use your incentive spirometer. Well, smoking is going to decrease your respiratory lung function, and it can put you at a higher risk to develop respiratory complications such as pneumonia and atelectasis, which is just a fancy way of saying that part of your lung can collapse. We are finally on our last tip, and I saved the best for last. This is something that a lot of people do not think about prior to their surgery, and this is who's going to be recovering with you. Now, I talk a lot about making sure that you have a recovery nurse, but even beyond your first 48 hours to 5 days of recovery, when you are back home, who you have around you is going to be imperative to your recovery. And the reason being is that recovery has a lot to do with your mental state, even more than it does your physical state. You want to have people around you who are positive, who are helpful, who don't mind going the extra mile to make sure that you're comfortable. Having negative people around you could put you in an even more stressed out state when your body is already stressed out, and mentally it is very challenging going through this surgery recovery. There are going to be good days, there's going to be bad days, there's going to be tough times when you have more pain than others. And the worst thing you can do is to have someone around you that's negative, that does not support your surgery, who is very vocal about not supporting you when you're already irritated and in pain. So make sure you start to think about these things. Look at the qualities of the person who's going to be recovering with you, and make sure that that person is really and truly supportive of your journey, and they understand fully what they're getting themselves into when it comes to helping you recover. This could be including running to the pharmacy to get you medications, helping to prepare meals, helping you up to go to the bathroom in the middle of the night. It could include helping you clean your environment, or even just being there for mental and emotional support. So make sure you think long and hard about who you want to recover with you, and it's going to make a world of a difference. I hope this video was helpful. If you're interested in more videos about health, wellness, and surgery recovery, make sure that you subscribe and hit the notification bell so you don't miss any of our videos. And in the meantime, check out our video on going number 2 after surgery. And I'll see you guys in the next video.